Hello, this is Dr. Stanley Lang, and welcome to Hope for Good Health. And today I'd like to share a story about a patient that I saw who was a new patient to our practice who has had psychiatric issues for a long time. She's not that old, but she's been treated for depression and other related issues since she was a young teenager. And so we got into the history quite a bit of the possible causes that are contributing to her symptoms. But what was astounding to me during this whole time is that she's not taking any vitamins, nor has she ever had a vitamin D level checked. Now, this is astounding in a time when vitamin D deficiency has been found to be epidemic in northern hemispheres, and particularly in the Northeast where I live. 100% of people are vitamin D deficient if they're not supplementing, unless they get a lot of sunlight, and very few people in this part of the country do. And she certainly did not. So here's a young lady that's been suffering for many years with her issues with depression and other related issues, and she's never had the benefit of even having her vitamin D level checked. Now, so we talked about how important this vitamin could be and how important vitamin B12 often is in this same situation. And many times I have seen both vitamin D and vitamin B12 deficiency in young people who have chronic depression. And so it's a routine thing that I check, or at least recommend checking, anytime that I see somebody with these kind of presenting symptoms. So the first point, if the person has significant depression, vitamin D deficiency markedly magnifies it. So I have seen patients go all the way from severe, profound depression all the way up to just mild depression simply by normalizing their vitamin D level. Now, when you fix the vitamin D level, it's critical that you also fix the vitamin K2 level, because vitamin D and K2 work together to help with calcium in the body, how the calcium is handled. I'm not going to get into that. I'm just trying to say that when you start to take vitamin D, vitamin K2 is critical at the same time. There are a lot of differences in opinion of how much vitamin K2 there should be taken, so I'm not going to get into that either. It's a pretty long discussion of the different opinions. But I would strongly recommend K2 for anybody who is taking vitamin D. The second point I want to make about this person is who's had this significant depression and other issues for more than 10 years. She suffered all through her teenage years and into her young adult years. And she is somebody who has probably one of the most rotten diets that I've seen in a long time. And she knew it. When I started asking her questions about it, she knew that it wasn't doing her any good. And in fact, it was not doing her any good. And it is doing her harm. And so that's the second point. Nutritionally, the micronutrients are critical, like vitamin D, vitamin K2, but the macronutrients are also critical. And it's critical that we don't eat foods where the macronutrients, that's the fats, proteins, and carbs, are contaminated by all of the junk that is being added to food in our country before it comes to market and after it's brought to the store and put while it's being packaged. And at the same time, the ultra processing of these fats, proteins, and carbs badly damages them, and in many cases it makes them a very dangerous chemical for your body by eating these ultra processed things. So she's got two things against her. She's, in terms of these two nutrient issues, one is that she's not eating a good mix of the right macros. She's eating a lot of the worst carbs you could eat, and she's also eating a lot of processed foods. So processed foods plus the chemicals that are part of that equals you're going to have a bad gut health. And if you've got bad gut health, you're going to have bad brain. So bad brain happens because the GI tract is intimately involved in your brain health. And your brain is not nearly as healthy as it could be if your gut is not healthy. And if you're not eating in a healthy way, your gut is not healthy. You're just used to being sick. So if you want to have the best of health, the best of mental health, the best of physical health, then you need to eat right in a way that supports the biome of your gut to be as healthy and as balanced as possible in the way that God originally designed you. There's a blueprint. It's discoverable. If we follow it, we can be really healthy in body and mind, and our spiritual health blossoms when our physical health is based on the principles that God put into us in the first place, and if our goal is to live in a healthy way as a way to honor God. So all three are linked together, and so pursuing honoring God through how we live our lives, to me, is a foundational strategy for achieving good physical and emotional health, because very few people will make the hard changes on their own just because they think it's a good idea. They're not likely to change their lifestyle to eat in a way that makes them healthy physically and emotionally unless you have a higher purpose. And that higher purpose is, the highest purpose is by trying to honor and serve God by our lives. And so I encourage you to think about these things, to do the things you can do for the sake of your health. I wish you well, God bless, and have a good day.